Welcome to KCHC Pulse Podcast. Today we have Donna Dossett, a women's health nurse practitioner. She's a Tennessee native but made her way down here to Eastern North Carolina. She's got 20 plus years experience in women's health and almost 4 years here at KCHC. Welcome, Donna.
Thank you, Tracy.
So today we're talking about a little more of an adult topic. So parents, if you're watching this with children around, you may want to either put in some headphones or wait until later where you can watch this without kids around. Today we will be talking about STDs, or sexually transmitted diseases. For listeners who may not know, Donna, is there a difference between an STD and an STI?
No, for all intents and purposes, no. Just we changed the lingo a few years ago to STIs, but essentially they're the same thing.
Okay. So are there certain populations or age groups where we see higher rates now?
Well, in this community, I would say it is a younger generation typically, and that isn't to say that a middle-aged woman or a woman beyond middle age is, I don't want to give false reassurance there, but it is mostly with our younger generation that I see.
But anybody who's sexually active is at risk?
Yes, anyone that's sexually active is going to be at risk, especially if it's a new partner and not using protection with condoms. Absolutely.
So what are the most common STDs you see in women?
The most common ones that I'm seeing here, and technically it is the most common STD in our country, and that's trichomonas, and that would be true for our community indeed. I see a lot of trichomonas.
So what symptoms would that or other STDs cause? What symptoms should we watch out for?
Trichomonas will definitely have you'll have a vaginal itch, and you'll have a thin, yellow, foul-smelling discharge most of the time. Now, I will say I have women come in here that are completely asymptomatic. Many of those women, however, probably have had it chronically for a while, and those symptoms, that trichomonas, that infection becomes, for lack of a better word, dormant, and we're not so much symptomatic anymore, but that's chronic. Initially, new infection with trichomonas, you're usually going to be quite itchy and have that discharge.
All right, so what about other STDs? What other symptoms should women watch out for?
Well, vaginal odor, vaginal itching, the discharge, those are typically going to be standard among any of them outside of HPV. But oftentimes chlamydia and gonorrhea, you don't have symptoms. So that routine check, especially if exposure to a new partner, you really want to get checked for chlamydia and gonorrhea.
So are there long-term complications if women do not get checked?
Mm-hmm, absolutely. So chlamydia, gonorrhea especially can travel up from the vaginal area up through the cervix and into the uterus, and then out to the tubes. And that can cause what's called pelvic inflammatory disease, PID, and it usually presents with fever, pelvic pain. But if not treated promptly, it can cause scarring of the tubes, and therefore, unfortunately, it can cause ectopic pregnancies or just inability to conceive.
So how often should someone be screened for STDs?
Every time you've initiated intercourse with a new partner, I would recommend getting tested at least within 4 to 6 weeks. I say not immediately for a reason, because some of our viral STDs, such as hepatitis, HIV, it may take a few weeks to trip a positive within the blood work.
So if I'm in a committed relationship, I still need to be tested later, like after at the beginning?
Yeah, no, I think it's a good idea. If you have ever had intercourse with another partner, or your partner has ever had intercourse with someone else, then coming in with that history, I think as a baseline, it's good for both partners to get tested, so you know on the outset that you're not passing something to the other one. In a committed relationship, that's wonderful. If you're both negative, then passing something to one another will not be possible.
Okay. So what does an STD test involve? What do I have to get blood?
Typically it's going to involve a vaginal exam, speculum exam. Yes, that's the metal instrument that nobody likes.
Nobody likes.
But that gives me good, clear access to do my vaginal swab and make sure I get right up close to the cervix. And then blood work as well. But I will say that we do offer self-swabs if a woman is concerned about the exam piece.
And that's part of the well woman exam, right?
It is. We offer it to every woman that's here for the well woman exam. Sometimes women decline it, but always offered.
Okay. And so this can be a really uncomfortable topic or situation or, conversation with patients. How do you make women comfortable with this conversation?
Well, I'm hopeful that I come across in a very accepting, non-judgmental way. That is my goal, and that is truly how I feel. I am not judgmental, and I really enjoy what I'm doing, and I feel blessed that I get to do this and help women be their best selves and be as healthy as they can be. So just hopefully I present and make and create an environment that feels accepting. That's my goal.
You do with me.
No, thanks,
I've
Tracy.
always enjoyed visiting you.
Thank you.
So what are the most effective ways to prevent STDs?
The most effective way will be abstinence. If you're not exposing yourself, you're not going to be infected. So abstinence first and foremost. Down the line, then the best is going to be using condoms. But I don't want false reassurance that it's impossible for you to get an STD using condoms, but condoms greatly will assist.
So if condoms can protect against STDs, and it's a form of birth control, can my oral contraceptives or those kinds of things my birth control protect me?
No, oral contraception, any other contraception outside of condoms will not prevent any STDs at all.
Okay, what about vaccines?
Vaccines can, for a couple. We have Gardasil, which will protect against HPV, the high-risk strains of HPV. Not for condyloma, which are genital warts, but, and then there's hepatitis B vaccinations.
Okay, and we offer those here, correct?
Mm-hmm, we sure do.
All right. So why is STD screening especially important during pregnancy?
It is very important because there are infections that can affect your pregnancy from very early on, can increase your risk for miscarriage, and also later on, and can cause preterm labor, preterm delivery. Yes, especially chlamydia, gonorrhea, and even trichomonas.
Can my STDs be passed on to my baby?
Yes, chlamydial infection can ultimately cause fetal blindness. And syphilis, HIV, hepatitis, yes.
Okay. So what happens if a pregnant woman tests positive for anything?
We will address it immediately. Whatever, the route of treatment, best route of treatment, best method of treatment, best medication during, for pregnancy. And as I'm thinking about treatment, all treatments would be safe in pregnancy, except for hepatitis B. I'm actually not sure if they can be treated during pregnancy. I'm thinking about Hep C.
Oh,
Hepatitis C. I do occasionally have a patient that's pregnant with Hep C, and I refer them to gastrointestinal doctors and have them at least consulted on that. So.
Okay. So the STDs, some of them can be passed. What happens if my chlamydia or gonorrhea is untreated and I'm pregnant?
Mm-hmm. So can cause early miscarriage because of a certain effect that it will have on the cervix and traveling up into the uterus, like I mentioned earlier. And causing an inhospitable environment essentially for that conception. And then later, if we get past that, again, similar process can cause contractions. Infection can cause contractions, and that can lead to, obviously, delivery too early.
Why do you think people are uncomfortable having conversations about STDs?
Well, there's a stigma to them in our society, and women, and I've been doing this a long time, and women that I have counseled through their STDs, a lot of them just feel dirty. I'll hear the word used that they feel dirty and unclean, and like they've been marked. So it generally, in certain societies more so than others, but it can create, I guess, a culture where women will just assume that they are
nasty.
Yeah, I hate using that word.
I know.
I really hate using that word, but that is the word that I hear from my patients, and it isn't how I feel or how people that love you, that are truly your friends, will not feel that way.
Right.
So
how would you encourage a woman to notify her partner if she comes up positive?
Well, hopefully there's a relationship there that the woman is trusting of that partner to be able to go to that partner face to face and have a conversation about it, hopefully a mature adult conversation about it. Sometimes, especially with trichomonas, like I mentioned earlier, trichomonas can be dormant. And sometimes if we haven't been checked before, we may not know we have something when we're coming into a relationship. So just because you're positive doesn't necessarily mean there's been someone stepping outside of that relationship. I always like to make that clear. Only you as my patient will know if you need to be worried about that. And so follow your heart there. But I hope that there is that relationship in place that you can go face to face and not just send a text, but a phone call.
It's always better face to face.
Ideally, having that conversation, yes. And making sure that they understand they need to be treated as well.
What would you say to someone who's hesitant or scared of getting tested?
I'd say fear is not your friend. Sometimes fear is helpful with certain things, but in this case it's not. Like, you definitely want to make sure that for your short-term and long-term health, that it's better to know. It's better knowing, and come here. I will treat you with great respect. I will hopefully do all I can to keep you comfortable through the process, answer your questions. So don't let fear hold you back.
Should a teenager who's never been sexually active or reports they've never been sexually active, should they be tested?
I would never impose that on a teenager. I definitely want her experience with her female health provider to be a positive one and not one of having things pushed upon them. I don't think that's a good way to get started with your female healthcare provider. But if maybe that isn't the truth and they truly are sexually active, I would invite them to know that they can do a self-swab here in this office at least. Many offices are offering that. So if the exam is causing you to hold back on being tested, don't let that be a factor.
No. So are STDs covered by insurance? Are they affordable?
Absolutely, yes. STDs, there's the testing really isn't anything that's so fancy and new that insurances now are not covering. This testing's been around forever, so has the treatment, and so accessibility is pretty easy.
And what if I don't have insurance?
Well, at least in our clinic, we're going to offer you a sliding scale. That's one of the many great things this clinic will offer. So don't let no insurance hold you back from getting tested either. We talked about fear. Well, no insurance shouldn't be a factor either. We'll help you out.
Yes. So there's a myth that people have said before. Can you get an STD from sitting on a toilet?
No, that is not true. No, I mean, we shouldn't be sitting on dirty toilets. I will agree. But you're not going to get an STD from a toilet. No.
Okay. Mm-hmm. So what about, can you get an STD from oral sex?
Yes, some things are passed orally. Herpes, for one. And sometimes you don't necessarily have symptoms of herpes. So orally is going to be more often the type 1 herpes, but that can be passed to the genital area. And chlamydia can also be oral, and HPV, the human papillomavirus.
And that HPV can actually lead to oral and throat cancers.
It absolutely does.
So it's really important to get that vaccine early.
Yes.
And you can get the vaccine as early as 9 years old, I believe, right? For the HPV. It's a great age to start before they ever get sexually active.
For sure.
If someone has no symptoms, they can still spread though, right?
Yes, don't let no symptoms be your reassurance, because I get many positives on women that aren't expecting a positive or even really concerned about a positive, just doing it to check a box at their well woman exam. So we have some surprises, and I don't want you to be that person, but yeah.
And can you get an STD more than once?
Yes, you can get an STD more than once. Yes, bacterial STDs, indeed.
What is one thing you wish every woman knew about her sexual health?
That she, above all, should have respect for her sexual health, because you're the only person that's going to 100% be able to safeguard the dignity and self-respect that you deserve. And some people out there don't have the best intent for our sexual health. And I would encourage all women to know that you're the first safeguard to that. You can say no anytime you don't feel respected or feel like you're in a safe situation. So don't just assume that the person you're with is going to have your health as the highest at the highest regard.
So if you could leave our listeners with one piece of advice about STD prevention, what would that be?
Abstinence is always going to be your best safeguard against any and all STDs. So I encourage women to wait. In our culture, that's not a word we like to hear or even support. And so, but for our own sexual health, our physical health long term, and above all our mental health, I think waiting until you're with someone that you know you're going to be with forever is always the best approach to our sexual health.
I agree. Thank you. Thank you so much, Donna, for coming on our podcast
Thanks
today.
for having me, Tracy.
We are very blessed and lucky to have Donna with us at KCHC. Before we leave, I would encourage everyone to make sure you book your appointment with KCHC OBGYN and get you an appointment with Donna Dossett. Have a good day.